What is the first step in the order of draw during venipuncture? A. Lavender top tube. B. Light blue top tube. C. Red top tube. D. Blood culture bottle. Answer, D. Blood cultures are drawn first to prevent contamination from additives in other tubes. Which identifier is acceptable for verifying a patient's identity before blood collection? A. Verbal confirmation of patient's first name only. B. Medical record number and full name. C. Room number and name. D. First name and age. Answer, B. Proper identification includes full name and a unique identifier like date of birth or medical record number. Which additive is found in a green top tube? A. EDTA. B. Sodium citrate. C. Heparin. D. None. Answer, C. Green top tubes contain heparin for plasma determinations. What is the correct action if a patient begins to faint during a blood draw? A. Continue drawing the blood quickly. B. Remove the needle immediately and protect the patient. C. Call for help and leave the patient. D. Splash water on the patient's face. Answer, B. Stop the procedure, remove the needle, and ensure the patient is safe. Which tube is used for coagulation tests? A. Lavender. B. Light blue. C. Green. D. Red. Answer, B. Light blue tubes contain sodium citrate for coagulation studies. How long should a tourniquet remain on a patient's arm? A. 30 seconds. B. 1 minute or less. C. 2 to 3 minutes. D. No time limit. Answer, B. Tourniquets should not be left on for more than 1 minute to avoid hemoconcentration. Which of the following is a critical error when labeling specimens? A. Writing the time only. B. Not labeling the tube in front of the patient. C. Using all capital letters. D. Using blue ink. Answer, B. Labeling should always be done in the presence of the patient to ensure accuracy. Which color tube has no additives? A. Red, glass. B. Lavender. C. Light blue. D. Gray. Answer, A. Red glass tubes do not contain additives and are used for serum collection. If blood flow stops during a draw, what is the first thing to check? A. Needle bevel direction. B. Tourniquet. C. Tube vacuum. D. Patient position. Answer, A. A blocked needle bevel is a common reason for blood flow stopping. What is the most common needle gauge used for routine venipuncture? A. 18 gauge. B. 20 gauge. C. 21 gauge. D. 25 gauge. Answer, C. 21 gauge needles are standard for routine blood collection. What is the function of EDTA in blood collection tubes? A. Promotes clotting. B. Preserves glucose. C. Prevents coagulation. D. Enhances serum separation. Answer, C. EDTA prevents clotting by binding calcium. What type of specimen is needed for a CBC test? A. Serum. B. Plasma. C. Whole blood. D. Urine. Answer, C. Complete blood counts require whole blood with EDTA. What position should a patient be in during a blood draw? A. Standing. B. Reclining or seated. C. Lying flat only. D. Leaning forward. Answer, B. Reclining or seated with arms supported is safest for venipuncture. What is the purpose of inversion of blood collection tubes? A. To speed up centrifugation. B. To activate clotting. C. To mix blood with additives. D. To reduce air bubbles. Answer, C. Inversion ensures the blood mixes properly with additives. Which of the following is a common source of preanalytical error? A. Incorrect tube color. B. Leaving tourniquet on too long. C. Misidentifying patient. D. All of the above. Answer, D. All listed can lead to inaccurate test results or harm. When collecting blood for blood cultures, what is essential? A. Use alcohol wipe only. B. Collect from the same site twice. C. Use strict aseptic technique. D. Collect after all other tubes. Answer, C. Blood cultures must be collected with sterile technique to avoid contamination. What color is the tube used for glucose testing? A. Green. B. Lavender. C. Gray. D. Red. Answer, C. Gray tubes contain additives to preserve glucose. What is hemolysis? A. Increase in white blood cells. B. Breakdown of red blood cells. C. Blood clotting. D. Incomplete filling of tube. Answer, B. Hemolysis is the destruction of RBCs, affecting test results. Which vein is most commonly used for venipuncture? A. Basilic. B. Radial. C. Median cubital. D. Femoral. Answer, C. The median cubital vein is prominent, stable, and least likely to bruise. Which of the following is not a reason to reject a specimen? A. Hemolyzed. B. Labeled at bedside. C. Clotted when whole blood was needed. D. Wrong tube type. Answer, B. Specimens should always be labeled at the bedside. This is correct practice. Which tube should be drawn first in a multi-tube draw, after blood cultures? A. Green. B. Lavender. C. Light blue. D. Gray. Answer, C. After blood cultures, the light blue tube is drawn next. What is the maximum angle for needle insertion during venipuncture? A. 45 degrees. B. 15 degrees. C. 30 degrees. D. 10 degrees. Answer, C. The recommended angle is 15 to 30 degrees for venipuncture. Which test requires chilling during transport? A. Blood glucose. B. Ammonia. C. Hemoglobin A1C. D. ESR. Answer, B. Ammonia specimens must be kept on ice to preserve stability. What should be done if a patient refuses blood collection? A. Proceed anyway. B. Document and notify the nurse. C. Ignore it and walk away. D. Threaten with delay of care. Answer, B. Document the refusal and inform the appropriate healthcare provider. Which tube contains sodium fluoride and potassium oxalate? A. Lavender. B. Green. C. Gray. D. Red. Answer, C. Gray top tubes are used for glucose testing and contain these additives. Why is the basilic vein used with caution? A. It is too small. B. It is close to major arteries and nerves. C. It rolls too easily. D. It's on the non-dominant arm. Answer, B. The basilic vein is near the brachial artery and median nerve. How many inversions does a lavender top tube require? A. 3 to 4. B. 5 to 6. C. 8 to 10. D. None. Answer, C. Lavender tubes require 8 to 10 gentle inversions to mix EDTA. What PPE is required for standard phlebotomy? A. Gloves. B. Gown. C. Mask. D. Face shield. Answer, A. Gloves are the minimum required PPE for routine blood collection. What is the best method for preventing needle stick injuries? A. Recapping needles. B. Using safety devices and immediate disposal. C. Bending needles before disposal. D. Using bare hands. Answer, B. Safety needles and proper sharps disposal reduce injuries. What is the additive in the light blue tube? A. Sodium fluoride. B. Sodium citrate. C. EDTA. D. Lithium heparin. Answer, B. Light blue tubes contain sodium citrate for coagulation tests. What is the most common cause of specimen rejection? A. Improper tube labeling. B. Drawing in the wrong order. C. Using alcohol instead of iodine. D. Drawing from the basilic vein. Answer, A. Mislabeling is one of the most frequent and serious errors that can lead to specimen rejection. Why must tubes be filled to the proper volume? A. To avoid tube breakage. B. To ensure accurate additive-to-blood ratio. C. To reduce clotting. D. To minimize hemolysis. Answer, B. Underfilling or overfilling can alter test results due to incorrect blood-to-additive ratios. Which of the following is a sign of nerve involvement during venipuncture? A. Slight bruising. B. Sharp, shooting pain. C. Hematoma formation. D. Blood return stops. Answer, B. A sharp, shooting pain or numbness indicates nerve contact or damage. How should a specimen for bilirubin testing be transported? A. On ice. B. Frozen. C. Protected from light. D. At room temperature. Answer, C. Bilirubin is light sensitive and must be protected from light to prevent breakdown. Which tube should be used for a stat potassium level? A. Red. B. Green. C. Lavender. D. Gray. Answer, B. Green top tubes contain heparin and are commonly used for stat chemistry tests like potassium. What is the primary function of a tourniquet during venipuncture? A. Increase blood pressure. B. Stop blood flow. C. Make veins more visible and palpable. D. Measure pulse. Answer, C. The tourniquet increases venous pressure to make veins easier to locate and access. Which of the following must be done immediately after needle removal? A. Dispose of gloves. B. Apply a bandage. C. Activate the needle safety device. D. Label the tube. Answer, C. Safety devices must be activated immediately to prevent accidental needle sticks. What complication may occur from prolonged tourniquet application? A. Increased platelet count. B. Hemoconcentration. C. Hemolysis. D. Hypoglycemia. Answer, B. Prolonged tourniquet use can cause hemoconcentration, affecting test accuracy. What is the most important step before performing capillary puncture? A. Shake the tube. B. Warm the site. C. Disinfect the site. D. Use the thumb for puncture. Answer, C. Proper cleansing is essential to avoid contamination and infection. Which of the following errors is most likely to cause a hemolyzed specimen? A. Using a small gauge needle. B. Mixing tubes too slowly. C. Not applying a tourniquet. D. Drawing from a large vein. Answer, A. Using a needle that's too small can rupture red blood cells, resulting in hemolysis.